I do want to open up a catheter and a syringe set.
Ask people around Emory about Dr. Steve Clements, and the superlatives start rolling out.
He's truly a legend.
He's a pretty amazing guy when you think about it.
He's a star in the crown of Emory.
No question about it. He was on a charmed path to be exactly the person that he is.
That path began in tiny Woodbury, Georgia, where Steve Clements was born and raised.
And everybody knew everybody, and in general, everybody knew what everybody else was doing.
You still carry some of that small town?
Not that I know of, but everybody says I do. You can, take the boy out of the small town, but it's hard to take the small town out of the boy.
But after high school, Clements' academic aspirations took him from his small town to the big city of Atlanta and Georgia Tech. His intention was to become an engineer. Midway through, though, he changed his mind and aimed himself toward medicine. He went on to the Medical College of Georgia and found what many will tell you is the path he was destined to follow.
Put it this way, he was born, I think, with all the qualities that it takes to make a very great physician.
And if you look at his family history, there was no doubt where he would end up.
There's a long line of Clements who went to Emory.
That line includes a great-grandfather, grandfather, and father. Dr. Clements came to Emory after medical school, joining what was a legendary cardiac program.
We had Dr. Hurst, we had Dr. Logue, we had Dr. Hatcher here, and those were giants in the field, and I could not have found a better place to do and to study what I wanted to study, so that caused me to pursue it.
It didn't take long for the young Dr. Clements to catch their eye.
I heard that his classmates had decided that he was the one that they would like to have treat them or their family, which I thought was a really good recommendation when all your classmates in medical schools say they want you for their doctor.
What kind of symptoms were you having when you came to the hospital?
Watch Dr. Clements with a patient, and it's not hard to see why he is so sought after.
He's got a unique style, and I think that's part of what he does. I mean, he's very personal. I mean, you see, he'll sit right down on the bed with them and, hold their hand.
And he just comes through with the sincerity, clarity, humility, and comprehensive ability to understand how he can focus on you and your concern about what's wrong with you. And that's what he does. And he does it all the time.
And where do you live?
It seems as if, in Georgia, you'd be hard-pressed to find someone he hasn't treated.
In one way or another, either he's cathed someone they know, or he's sent someone for valve surgery, or, in one way or another, he's taken care of almost everyone or someone's family member around here.
If you talk to a lot of people across Georgia, they actually think that Steve Clements did their heart surgery. He's not a heart surgeon, but they think that he did their heart surgery. So Steve, can't tell you how many aortic valve replacements people say you've done. I hope you didn't bill them for them.
What about, could we set up something over there now, or how you doing?
When it comes to Steve Clements, there is no standing still. If he's not seeing patients, you might find him in the outpatient cath lab he helped to create.
Okay, shoot him up.
Or you might find him passing along some of his knowledge and experience. Whether it's talking to students or with his colleagues, working in an academic environment is something he loves.
There's no better learning environment than the medical school environment. When one has students around, house officers around, fellows around, not only do you teach them, but as a matter of fact, you may learn more from them than you teach.
And if you're his student, you'd better be prepared to learn about more than the heart.
is always calling our trainees up and saying, I've got a patient, he has a heart problem, but that's not what he's coming in for. You know, we're going to take care of that, aren't we?
That's because Steve Clements has always been more than just a fine cardiologist.
Say finest physician. So he's not just a cardiologist.
And Steve Clements is not just a doctor either. He's an avid golfer and a terrific tennis player, a fisherman, a hunter. He even tends a small farm near his old hometown.
You know, how he's able to wear all these hats, golfer, tennis player, farmer, you know, all the stuff he does, I don't know where he finds the time. We're pretty sure he doesn't sleep.
But perhaps most important to Steve Clements is his family, his wife Helen, his 3 children, and 3 grandchildren. It's hard to believe one person can do it all.
I guarantee you there's only one of me.
No one at Emory University Hospital would disagree. Dr. Steve Clements is indeed one of a kind.
Personally, I think Steve is the finest clinical cardiologist of his day. And I think the finest cardiology so far of this century. If you're his patient, you are very lucky indeed.